Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you the update for cases, which includes a total of 488 cases reported over the week of January the 3rd to the 9th. We have also had some deaths over the last week. I regret to inform you about 3 people who passed away. They are a man between the ages of 65 and 79, a man between the ages of 65 and 79, and a woman in her 80s, all of them living in Simcoe County. And I would like to express my condolences to the family members for your loss. If we look over the past week, we find that from the week that began on the 3rd of January, sorry, I can hear some background noise. If everybody can make sure that their line is muted, that would be great. Thank you very much. If we look at the week of January the 3rd, we had 487 cases, which is up considerably compared with the previous week at 405, which is up substantially from the week before at 345. So that's very much an ongoing steep increase in our case count and in our weekly rate of cases. So if we look at the cases that we've had just since yesterday, so far this week, it's a total of 61. And they range in age from under 10 to in their 80s, with 4 of them living in Muskoka and the rest living in Simcoe County. So at this point in time, we have 1,277 active cases, which is up basically a doubling from the week of December the 22nd. And we have a total of 2,529 recovered cases. At this point in time, we have 35 cases in the hospital, up from 26, and their ages range from 20s to their 90s. All of them live in Simcoe County, and 3 of them are in the intensive care unit. These are, by the way, cases hospitalized who live here. They're actually located in Simcoe County, some of them elsewhere in the province in terms of where they're receiving their care. But we have other individuals who are being provided care here at hospitals, and our hospitals, both RVH and Soldiers Memorial Hospital, are both receiving patients for care from the Greater Toronto area in order to help support them, because they have so many cases in hospital right now in that part of the province. So currently we have 24 outbreaks, up from 20 in the past week, and 13 are in institutions, long-term care facilities, and retirement homes. 5 of them are in congregate settings in group homes, and 5 of them are in workplaces. So various businesses and services in Simcoe County, with 1 in the District of Muskoka. We have no schools and outbreaks since they are closed, but we have had 2 outbreaks in child care centers which have been declared over. And we have 1 outbreak in a food and beverage location in Simcoe County. If we look at the incidence of cases from January 3rd, this is the first week in which had more than 80 cases per 100,000 population per week. And so that's very high. That's up from 60, which was what it had been a week ago. not quite at the 100 level where the province had been, from what we've seen, declaring areas to be in lockdown in the gray zone with the old framework that they were applying before they put in place the shutdown, and before today the declaration of an emergency and the stay-at-home order that's now in place. But still, 80 cases per 100,000 is very high, and noting that it's gone up rapidly from the previous week. That's certainly cause for great concern. And if we look within Simcoe, Muskoka, the concentration of cases is greatest in the south, and in particular in Bradford, West Gwillimbury, where they have an incidence of 228 cases per 100,000 population per week. So that is very high. And that's up from the previous week of 150 cases per 100,000 population. And that's 4 weeks in Bradford, West Gwillimbury, in which they've been above 100 cases per 100,000 population per week. So very high. That community in particular is experiencing a very high incidence of cases. Also, I would say that the community of New Tecumseh Township is also above 100 cases per 100,000 per week at 154 cases per 100,000 per week right now. So that too is very high. In the midst of all of this very disturbing news, we do have the light at the end of the tunnel, and that is immunization or vaccination. And since the 22nd of December, we have been providing immunization in partnership with RVH and the City of Barrie at their clinic at 29 Sperling Drive, and have been among actually the second highest provider of vaccinations since immunization began in the province, compared with the other sites that are providing vaccination in the province. So doing very, very well. And I would really like to commend the partnership that we're in to be able to achieve that. And also have some very good news today in that we yesterday launched a pilot to take vaccination to our long-term care facilities. So we went to 2 facilities, Oak Terrace in Orillia and Victoria Village in Barrie, and between those 2 facilities immunized 178 residents. So this was a health unit staff in teams doing this with support from RVH with regards to the handling of the vaccine. We had support from their pharmacy personnel to be able to do that well, and a lot of support from the facilities themselves, the staff themselves at these facilities. So this is a success. And because of that success, and because we continue to have vaccine from the province, we're able to now, through this week, go to all of the other long-term care facilities and provide them, their residents, with immunization. This is really critical because this is the population that is at greatest risk of outbreaks and serious illness and death. And so by vaccinating these people, we're going a long way to reducing death from COVID-19 in Simcoe, Muskoka. So we intend to have that done by Saturday. And then we intend next week to proceed to the retirement homes and to vaccinate their residents as well through the course of the week. And they too are at a high risk. We've provided at the clinic in Barrie at 29 Sperling Drive, we provided immunization to the staff of these facilities, to the staff of long-term care facilities, and to the essential caregivers who provide care, family members who provide care to the residents of these long-term care facilities. So over 8,000 people have been immunized so far at that clinic. Healthcare workers who work in these facilities and work in hospitals, and that too will go a long way to protecting these facilities. Just over half of the staff of these facilities now have been immunized at that site, and we want to continue to provide immunization as supply allows, and over time to be able to protect those staff as well. And by protecting those staff, you protect the services that they provide, and you protect the patients that they care for and their residents that they care for. So with regards to our dashboard on our website, the dashboard that we created for ourselves, different from the province's framework, we remain in red status, so that is unchanged, and that's because of the degree of viral spread that is increasing and the numbers of outbreaks that have been happening. Also because of laboratory testing, we continue to have a fairly low turnaround time in the laboratory testing within 1 to 2 days. It's below target. Our health system capacity remains at yellow status with a bed occupancy and ICU ventilator occupancy that is about the same as what it has been, and has so far to date not been overly taxed by admissions for COVID-19 in our district, although I do note that we have some that have been transferred here from the GTA. And in terms of public health capacity, we remain in red status because we're struggling to keep up with the case count and to follow up with the cases, and have not been able to reach them within 24 hours. The majority we cannot reach it within 24 hours, so we remain in that red status. We've asked the majority of those cases to contact their contacts for us using our script that we have on our website in order to inform them that they need to be in isolation and seek testing. So we look at our trajectory data from January the 3rd to the 9th, our incidence at 68 cases per 100,000 population, which is up from the previous week at 58 per 100,000. And to be compared with Ontario, which is 135.4 per 100,000, and last week 106.6 per 100,000. So we're going up rapidly. The province is also going up rapidly. The province is higher than we are because of the very high case counts that are occurring in the GTA to the south of us. Our reproduction number is 1.3, which is up from 1.0. So anything above 1 means that there's growth happening. It's not coming under control. And our doubling time has shrunk, which speaks to rapid growth. So our doubling time now is 43.7 days. And with that doubling time, you would expect to see 7,500 cases in Simcoe, Muskoka by February the 15th. So our daily growth rate is 1.8%. So if this were to keep up, then we would have approximately 750 cases during the week of January the 31st to February the 6th, or around 107 cases per day, which would equal a rate of 125 cases per 100,000 population per week. So above that level of 100 that I talk about with, and what we've seen with the old framework designating lockdown gray status. So all of this really drives home the critical importance of people really taking to heart the control measures that I'm always speaking to, the importance of physical distancing for people who are not in your household, maintaining 2 meters distance from them, not having people over. We now have a stay-at-home order and a declaration of an emergency. I need to look at the details, because that's just been announced, so I need to look at the details as to what exactly that means and what is exactly in the regulations that we will need to enforce and that people will need to abide by. So that is certainly a task for me, for all of us to understand that. But I'm sure that what would be at the heart of it is that we shouldn't be going out unless we have an essential purpose, such as shopping or attending work or seeking medical attention or buying pharmaceuticals, medications. I'm hopeful that it also includes provision for people to get out for exercise. That's the kind of thing that I've always advocated for, but I need to see what's actually included in that requirement. So in terms of the outbreaks, one thing I would note is I'm very happy to say that the outbreak at Georgian Bay General Hospital has now been declared over. That is a good thing. I'm just having a double check on that. Okay. Actually, I want to look into one detail about that and get back to all of you about the details on that. So I'm just putting a hold on that for the moment. We've got Trillium Manor located in Aurelia with an outbreak that was declared on December the 14th. And the number of staff cases has increased. It's up to 19 from 13 a week ago, and the number of resident cases is 9, up from 8 a week ago. We've got Rivera Serra Vista in Elmvale, which has 1 resident case and 1 staff case, up from 2. And Georgian Manor in Penetanguishene with an outbreak declared on December the 27th with 3 staff cases, which is unchanged from a week ago, and 3 resident cases, up from 2 a week ago. Tiffin Retirement Residence in Midland with an outbreak declared on December the 27th, which has 1 positive staff case, which is unchanged. Lakeside Retirement Residence in Innisfil, which has 2 positive staff cases, which is unchanged. Woods Park Care Center in Barrie with 1 staff case, which is unchanged. Villa Retirement Lodge in Midland with 2 staff cases, which is up from 1 a week ago, and 2 resident cases, up by 1 from a week ago. Simcoe Manor in Beaton is 2 staff cases. Grove Park, 2 cases, up from 1 a week ago. The Pines in Bracebridge, 1 staff case. And Roberta Place, long-term care facility in Barrie, an outbreak declared on January the 8th, which is very big. It's rapidly progressed, very unfortunately. And so they have 40 resident cases and 2 positive staff cases. 1 resident who passed away. So this is a very concerning situation. We're working closely with this facility to see what they need in the way of support in order to manage the situation, but given how rapidly it's progressed and its size, it is a worrying situation. And an outbreak at Royal Victoria Hospital, Royal Victoria Regional Health Centre, declared on January the 9th with 7 positive patient cases and 3 positive staff cases, with investigations ongoing, management of the unit that's involved in order to test and isolate those that are required to be isolated. So we work closely with RVH in the management of that situation. And then Waypoint Care for Mental Health in Penetanguishene, outbreak declared on January the 9th. And that consists of 2 patient cases and 1 staff case. And testing of those on the affected areas has taken place. We await results. If we look at our congregate settings, we've got a group home in Simcoe County that has 9 staff cases, up from 7 a week ago, plus a temporary staff member who's a case, and 3 positive cases among residents, up from 1 a week ago. We have a group home in Simcoe County, which has 3 positive staff cases that's unchanged from a week ago, and 1 positive resident case. We have a facility, a care facility in Muskoka, that a congregate setting that has 3 staff cases and 1 resident case. And we have another care facility in Muskoka with 1 resident case and test results otherwise negative. And a shelter in Simcoe County with 1 positive staff case and testing otherwise being conducted at the site. We have in the for community outbreaks a food and beverage agency business in Simcoe County that had an outbreak declared on December 31st with 5 individuals involved, 5 positive test results. Okay. We have an outbreak at a emergency services location in Simcoe County with 8 positive cases and testing taking place there, and a business in Simcoe County with 4 positive cases and otherwise testing being conducted on all the other employees working at that location, and no members of the public exposed. And we have another business in Simcoe County declared on January the 8th with 3 staff, and another business in Muskoka declared on January the 11th with 7 staff cases and others being tested. So that is all of the outbreaks. In terms of my media messaging, I've already spoken to immunization and how important it is. The success that we've had to date, the fact that we're one of the leading locations in providing vaccination, certainly using up all the vaccine that we receive. We get it in regular installments. We have been administering it and then using what follows in the way of vaccines. So certainly been keeping up with the supply. So at this point, we've had a total of, I said over 8,000, but it's actually over 8,100 doses of vaccine administered to priority groups in Simcoe, Muskoka. And certainly we've had a lot of inquiry about groups that would be next to receive immunization. There's a lot of interest among healthcare providers who are not in those facilities I've discussed, that work in other facilities in the community, that are very interested in immunization. And there's certainly been a lot of questions about whether paramedics should be immunized. In my opinion, those are all high priority groups to receive immunization, and we are planning to be able to provide them with immunization once we have enough of it, and once we've finished with protecting the residents and the staff of the long-term care facilities and the retirement homes, and ensuring that there's vaccine for other healthcare workers in hospitals as well who would want it. So we have to work with the supply we have and work through those groups. We have every intention of moving on and then protecting other groups as well. And through the course of time, as the vaccine becomes more and more plentiful, we will broaden out the provision of vaccine eventually to the entire community, working with other partners to be able to deliver it. So we do have a planning process in place to be ready to provide that kind of immunization. We've got a committee coming together, an advisory committee this week with representation from the Indigenous community and from primary care and community pharmacies, long-term care, emergency medical services, paramedic services, and also our planning organizations such as the Central Region of Ontario Health. So we're having that group come together in order to help us craft the big plan for how we'll do this over the weeks and months to come, to be able to work with those groups as the vaccine becomes more plentiful, to be able to administer it broadly to the public. So the province's intention is that everybody who's eligible for a vaccine, who would want a vaccine, would have received it by August. And we have every intention of working with that timeline and the supply that we get to achieve that goal. As I said, I've said before, this is the way in which we will gain control of this pandemic. Right now we have tremendous growth, unfortunately, tragically, of cases, and the province needs to do what it has to do with a stay-at-home order and the other measures they're putting in place to help bring it under control. And all of us need to do our part to be part of the solution and abide by the control measures that we've been asking of everybody and, when necessary, requiring of everybody. But in the end, the vaccine is going to be absolutely critical to be able to bring this under control and allow us healthier, safer, more normal lives to come. We've done all that we can to make sure that we don't waste any of the vaccine, and strive to have a very, very low wastage rate. We have also managed to stretch that resource by getting 6 doses out of each vial instead of 5. So the manufacturer guarantees that you can get 5 doses, but we and other health units in the province, other hospitals in the province have found that if you're careful, you can get a 6th dose out of each vial. And so that increases your coverage by another 15%, which is excellent. And so we're certainly striving to achieve that, and in most cases we're able to achieve that. We're also making sure at the end of the day that we don't waste any dosages. If we have any left over in the vial, we have a callback system to allow individuals who are in the priority group right now, hospital workers, long-term care facilities, retirement home workers, and essential caregivers who live within a reasonably close distance, who are interested in being on a callback list. We call them in and have them receive the last dosages that are left in any of the vials that are opened. We have to do that because once you've used some of a vial, you've got to use the rest of it within the 6-hour period that you've been that you've had it available to use. So you've got a limited time to work with. Okay, so. We have some changes with regards to the reporting of outbreaks on our website coming up. So we're going to provide more detailed information on the outbreaks in healthcare facilities, long-term care facilities, hospitals, the kind of information that I give, sort of the name of the facility, the number of cases involved. And that will be a tally that will remain on our website even after the outbreaks have been declared over and they've been moved farther down the list. So we wanted to be able to provide that to you. We also anticipate being able to provide more information about other workplace outbreaks, more fine designations of the types of locations that we're talking about. We were asked before from time to time. And then last week, with an announcement from Toronto Public Health about their intentions, we were asked whether or not we would do what Toronto is doing. So we're going to do what they're doing with regards to more information in general about our outbreaks. But at this point in time, we're not going to be proceeding with actually giving the names of facilities in outbreak that are private facilities, not public institutions, not long-term care facilities. Those facilities we do provide the names for, but other businesses or private workplace environments, we will continue not providing those names for now, because the need to protect privacy of the individuals that might be part of those outbreaks, and also to avoid causing unnecessary harm to businesses. We do give that information if it's necessary, if the members of the public have been exposed and we can't reach them by another means, or if the business themselves actually gives their name. The City of Toronto, with the practice that they're going to do is start giving the names of such businesses if it's a large business, so large that there wouldn't be the potential to identify individuals who are cases by giving the name of that facility. And if the outbreak is ongoing over a long period of time, and they haven't really defined either of those, either what the threshold would be for size or duration. But when we look at the outbreaks we've had, they've always been in facilities that are not very large. And so we feel that we probably, even if we were to take on that approach, we probably would never meet the threshold or the size in question. We also are going to make a change with regards to the information that we provide about individual cases. In order to protect privacy, we're not going to give the details of the setting of outbreaks related to cases. So about individuals related to outbreaks, and that would be to help protect their privacy. Okay. One thing I would note about gatherings that we've had at this time, holiday gatherings. I noted before that we'd had a measurable increase in the number of cases, percentage of cases that were associated with gatherings at Thanksgiving. And so we looked again at our data with regards to Christmas time gatherings, the holiday season at this time, the one that we just passed through, and we found that 21% of our cases were associated with some kind of gatherings, family gatherings or gatherings with other people. The number of people involved in those gatherings was anywhere from 2 to 22 people, with the average median number being 6 people. So this really speaks to how much we need people to avoid gatherings. And now it's required with the state of emergency, but we really need people to abide by that because this is a major means by which transmission happens. Okay. Last week we had a question about gender and COVID-19 and whether it was linked with gender in some way, what the pattern had been. When we looked at our data, we found that in the first wave, there was a higher incidence of cases among women, and in the second wave so far, a higher incidence among men, and I think this might have been related to in the first work environments. But between those two waves, overall at this point in time, the incidence of cases is essentially, cumulative incidence of cases in men and women is essentially the same for Simcoe Muskoka. So a couple of media questions that have come up are as follows. What are the stumbling blocks we have and may have now and in the future regarding vaccinating our population? So to me, the greatest challenge is actually supply. We received supply. We expeditiously worked with RVH in the city of Barrie, and also with some support from Simcoe County Paramedic Services, to establish our clinic at the old police station in Barrie. And we are continuing with success at that clinic. We're the second highest vaccinators in the province. And now we're taking vaccine and we're moving it out to the long-term care facilities and protecting the residents there. So we're moving along and using the vaccine expeditiously, and certainly able to keep up with the supply. And so what will really help us is as the supply builds over time, in keeping with the province's plans. So the province has a plan of ever expanding the supply until we, as a province, are seeing in the range of 5 million doses a month in the second quarter of the year. And that would certainly give us a great deal more vaccine to work with. And when that comes, we will need all of our partners, primary care and community pharmacies and others, to be delivering the vaccine to their patients. So it'll be a process of recruitment of assistance, just like each year we do with the influenza vaccine. Of course, there'll be other challenges as well. I would say another challenge right now is an intense desire for vaccination and keeping up with expectations with regards to that. There are certainly priority groups that we need to get to protect them. I've already touched on this earlier with regards to healthcare providers in the community outside of hospitals and the long-term care facilities and retirement homes. So those that work in other clinics, those that work in the assessment centers, paramedics are certainly priority, and there's others you can think of beyond that as well, other first responders. And then, as you roll it out, you can imagine you'd then want to be working with, as we get a lot of it, healthcare providers, family physicians, to be giving it to those in the community that note of this, and to inform these people that this is coming, and that we certainly take very seriously their need to be vaccinated and are getting ourselves ready to do so. Another question: Bradford has the highest incidence rate in the region, where most of the cases are coming from. Where are most of the cases coming from? Is it because we are closest to the GTA and many are traveling there for work, or because more testing is being done now with our pop-up test centers? So in my mind, it's not about testing. The testing needs to be done. It's about transmission, and we are indeed seeing, and have always seen, much higher transmission in South Simcoe than elsewhere in our district. And it's when we look at the individual cases related to people's movement, where people work. A lot of people work in the GTA and can be part of outbreaks that are work-related. Or where do they socialize, or where does their family live that they gather with, or friends with that they gather with. That's been the pattern of transmission that's affected that part of our territory. And basically it begins that way and then goes from there, affecting entire households and then affecting other work environments here. Okay, I think that takes me to the end of what I've got for today. I'd be happy to take any questions or comments.
Okay, thank you, Dr. Gardner. Let's start with Eric Engel. Sorry, Kathy, can you come back to me? Absolutely. Let's go to James Bowler, Cogeco.
Thank you. Dr. Gardner, I think probably a lot of us are wondering what your response is to the announced measures today. From the perspective of the public, it doesn't seem like there's much heat behind what they're offering. It's not too much different from what was put in before. How can the health unit kind of play a role in the enforcement of this?
Well, we do need to have a look at the protocol, the regulations that would come, because that's got the detail in it for us about how we would enforce, exactly what are we to enforce. Of course, we're always limited in how much we can enforce as a health unit. We're very stretched as an agency. We've got the case and contact management, we've got this enforcement piece and education of businesses, and then we got vaccination on top of that. So we're limited in how much enforcement we can do. Fortunately, this is a across-the-board effort that also can involve police and bylaw officers, and for work environments can involve enforcers with the Ministry of Labor. So we're going to need all of that capacity to be able to do what's in store. But until I can see the details, it's hard to really comment.
Do you think so, based on what you've heard so far about this? I mean, they're saying a stay-at-home order is being put out. Again, it's not a curfew. It's not forcing people to stay home at this point, from what we can tell. But is that going to help bring these numbers down? I mean, we're seeing if we reach 7%, we're going to get 45,000 by February. Is this measure right now really going to stop that?
Enforcement is going to be a really important part of this, and what is specified in the details of their legislation, their regulations, is key. So I would really need to know that to be able to answer the question well. To me, if in fact it is all about people not going out unless they have the list from the province, whatever that list would be, and if it is actually enforceable, if it comes with a fine if you violate it, and then if it is enforced, say by police, I think it would have good effect, right? And it probably doesn't take a lot of enforcement for everybody to realize that we mean it, and therefore they need to abide by it. If people actually abide by this, most people, the great majority of people abide by this, I think it would have it would take a while. We know that there's a delay of 2-3 weeks before you really see the effect of a shutdown or a lockdown start to flatten the curve and bring it back down again. But I believe if in fact everybody or most people abided by this, it would have the desired effect.
Thank you.
You're welcome.
Thanks, James. Brett Glover from Barry 360. Are you on the line today? Okay, let's go with Matthew Reeser from the Loop. Do you have a question, Matthew?
Yes. Hi, Dr. Gardner. How are you?
I'm well. How are you?
Good. The latest number on the health unit's website says that nearly 8,000 COVID vaccines have been administered in Simcoe, Muskoka. Mm-hmm. What are your thoughts on how the rollout's been done locally in Simcoe, Muskoka, and how it's been handled on the provincial level as well?
So when our numbers catch up on the site, it should be 8,100 doses, and we know from data that we have access to, we are number 2 in terms of a location providing vaccination, the second highest number of vaccinations provided in the province. We've done our very best to provide them to the priority groups the province wants us to, and that I support. We are moving quickly now to get out to those who are most vulnerable, those residents in long-term care facilities and then retirement homes. That's where we're getting over 60% of mortality happening. So I think we're off to a very good start locally. Of course, we need to keep up the momentum, and that means good planning with all the other partners that are going to be needed to carry this through to the very end. So it's a good start. It's just the beginning. I know that provincially there's been in the media criticism about the slowness of start across the province, but I've seen it build very quickly. I do think it takes some time to get your systems in place to be able to immunize the population. This vaccine came early. It came faster than we thought, which is a great blessing, but it also meant we had to move quickly to build up our system. So we, just like locally, we need to it's just a start. We need to keep building. Across the province, we need to keep building. And part of that building is an ever-growing supply of the vaccine. So we've got to the point now that we can administer what we're receiving, that there's not much lag there at all. So that's good, but we need the supply to continue to grow.
And I admit I have been having trouble getting the website past couple days, so I might have missed this if it is on there. Mm-hmm. But is there broken down data of where the vaccine is being administered, like where in Simcoe, where in Muskoka, what homes, and so on?
So far, only 2 homes, Oak Terrace and Victoria Village Manor, yesterday as pilots. But I can see that there would be a desire to get that kind of information. And people may very well want a breakdown of what's the coverage like in among the staff, by sub-region within Simcoe, Muskoka. How does it compare, say, with Muskoka versus other parts of Simcoe County? How do hospitals compare with long-term care, retirement homes? I can see that there'd be a desire for that. We're tracking that internally, but I'll have discussions internally here with my team about how much of that information can we make available. When you look at our site, you see a great deal of information available about cases, so I would position the same thing about vaccination coverage. How much can we provide that people would want to see?
Okay, thank you, Dr. Gardner.
You're welcome.
Thank you, Matthew. Chris Simon from the Very Advanced. Are you on the line today?
I am. Thank you. Hi, Dr. Gardner.
Hello.
I'm just curious as to the enforcement aspect of what was announced by the Ford government today. How many fines, charges, anything like that do you know of that have been laid within Simcoe, Muskoka? I know that there's been a priority given, I guess, to education rather than enforcement in the past. But can you speak to that?
So we're interested in starting to post information on our site about charges laid. It's something we're working up as a process, and we'd like to get that up soon. For 2 reasons. There's intense public interest in it, and also it might act as a deterrent for venues, like businesses. So that I would put up. I think we'll start putting up a tally of the total number of charges and a tally of the total number of orders. What I'd like to do is get that tally for you and get it to you rather than hazard an approximation right now.
Okay. One of the measures that was announced by Ford was a blitz of big box stores. Do you see them as a problem at this point, or is it elsewhere that is the main source of contraction of the virus?
So it's possible the transmission could be happening in retail locations. We don't have evidence that it is. We have lots of evidence that people's social gatherings and large family gatherings have been an issue, that where people work has been an issue. Certainly congregate settings like group homes and retirement homes and long-term care facilities and hospitals, there have been outbreaks. So those kinds of environments have been an issue. In theory, for sure, you could imagine that the kinds of gatherings that can happen in retail locations, large retail locations, could be an issue. But we don't actually have the data that shows that definitively here in Simcoe, Muskoka.
Okay, and I'm sorry, maybe I missed it off the top, but do you have any information on the 2 new deaths that were reported today?
So I spoke at the very beginning about 3 new deaths and gave their age ranges and genders. So that you'll find at the beginning of today's report that it's up on YouTube.
Sorry about that. I must have missed it. Thank you very much.
Yeah, you're welcome.
Okay, thanks, Chris. Adrian, proceed Intermediate from my family. The question.
I do, thank you. Previously, you mentioned, Dr. Gardner, the number of vaccinations being done in the northern part of Simcoe County. Do you have the numbers yet for the southern area?
If you look at our website, we generally keep track on a monthly basis with regards, if you look under geography, and then you scroll down, there's a table that has the incidence per 100,000 population per municipality for the month of January. So you'll find the incidence there. You see how that breaks down for each of the municipalities. So I know that that's not cases. You can have above it is a tally of all of the cases that have occurred in each municipality, but that doesn't give you the most recent.
Right, I know the number of cases, but the number of vaccinations.
Oh, I misheard you. I beg your pardon. We don't have that information up. We do not have that information up yet. I would like to explore with my team how much more information we could put up that would be useful about immunization. So far, the only thing we have up there is the total and what's been done in the last day.
Okay. I have another quick question.
Mm-hmm.
Can you donate blood if you have received a vaccine, whether it's the first or the second one, and should you wait a certain amount of time before doing so?
You should be able to donate blood. It's not a live vaccine. It doesn't have the virus in it. It has it's a new type of vaccine, messenger RNA vaccine. It has a little small portion of genetic code to help your cells of your body produce one of the proteins for this virus that then your immune system becomes primed to so that it can fight off the virus. So it's not living, and it's not therefore harmful. It's not going to transmit to other people. And I've, in the product monograph, as well as the recommendations in the National Advisory Committee and the immunization on these vaccines, have said nothing about a restriction on donating blood.
Okay. Thank you.
Thank you, Dr. Gardner. Alison Brownlee from the Muskoka region, do you have a question?
Yes, thank you. Dr. Gardner, we've heard about the first vaccine at RBH that was given out, and we've just today heard about vaccines being rolled out on the road in Aurelia. Have there been vaccines to long-term care retirement residents and hospital workers in Muskoka? And do you still intend to meet this Saturday target for long-term care home resident vaccinations in Muskoka as well?
We have every intention of immunizing all the residents of all the long-term care facilities in all of Simcoe, Muskoka, including Muskoka. And it looks at this point like paramedic services for Muskoka is actually going to give us some assistance with some of those locations, either in the long-term care facilities or in the retirement homes to follow next week. So we have every intention of going. Yesterday, we went to a location in Aurelia and Barrie. Today, we're doing a number of homes. Off the top of my head, I'm not sure if any of them are in Muskoka, but we can get you that information. And if there aren't any in Muskoka today, we can tell you what we intend, I guess, later in the week.
Thank you.
You're welcome.
And you mentioned the working group that is in talks, or is being struck to then get into talks about the rollout plan with community partners. We have heard that there is a healthcare professional in Muskoka that may be involved in those talks. So preliminarily, is there any intention to provide multiple vaccination clinics in Muskoka? Like not just one community, but possibly in all of the urban centers, or a mobile clinic for our rural areas as well?
I think we'd have to wait and see what comes out of our meetings with this advisory committee. I fully recognize that the more locations you have, the more options people have, and the higher the uptake is for immunization. So the more we can diversify that, the better we'll do. Ultimately, if I have my way, you'll reach a point at which most family physicians would have the vaccine, most pharmacies would have the vaccine in every community.
Thank you very much.
You're welcome.
Thank you, Allison. Natasha Philpott from Bradford today. Would you like to go ahead, please? Natasha, are you there? How about Mandy Webster from Rogers? Do you have a question?
No questions for me today, thanks.
Thank you, Mandy. How about Marge Brinman from Barrie today? Are you on the line, Marge?
Sure, thanks for the opportunity. My first question is about the Moderna vaccine. I don't think it's here yet, but when is it anticipated? Will there be a separate vaccine clinic center be established to deal with Moderna?
Okay, so I'm just going to repeat your question to make sure I got it right because I couldn't quite hear it all, but you were wanting me to confirm that we haven't received the vaccine yet, and that's true, we have not. Wanting to know when it would be here and would there be a special clinic approach to dealing with it? Would I be correct on that?
Bang on, thank you.
Okay, so no, we've not received the Moderna vaccine. We don't know when we'll receive the Moderna vaccine. My understanding is that it's been redirected to the parts of the province with the heaviest case counts to help them deal with that situation. So we're instead working with the Pfizer vaccine. We'll keep working with the Pfizer vaccine. We're learning how to move it, which is great. Up until before the midweek last week, the 6th of January, we weren't allowed to move it, so now we can move it. That gives us a lot more options. But I do look forward to the day that we have other vaccines to work with as well, Moderna and possibly others that have yet to been approved by Health Canada. The more we have of it, the more options we have. And it would be good to be able to work with vaccines that are less technically demanding than the Pfizer vaccine, which requires a lot of care, basically.
Thank you. That kind of piggybacks to my second question, and that is doses that have been diverted from Simcoe, Muskoka, elsewhere. I don't know if this is a fact or if that's in reference to the Moderna vaccine, but have you been getting lately fewer vaccine doses than you anticipated here in Simcoe, Muskoka?
We've received the same number of Pfizer vaccines that we were informed we would be getting. What we've not got is the Moderna vaccine that we thought we would be getting. That's been redirected. So we have to, overall, we're working with a little bit less than what we thought we would get because the Moderna vaccine has been redirected.
Thank you.
You're welcome.
Thank you, Marge. Erica Engel, would you like to go ahead now, please?
Yes, thank you. My question is about hospital capacity, which is a hot topic provincially right now. The fact that Simcoe County and Muskoka, I guess, hospitals have to start taking, or they have to create capacity, right? Just in case there have to be transfers from around Ontario.
Yeah.
Is that also impacting, like, is that going, hospitals filling up, would that impact the ability to roll out the vaccine? Are you relying on staff at the hospital for any vaccine rollout? How concerned are you to see hospitalizations climbing elsewhere and the potential for those hospitalizations to have to come here?
So I'll answer your first question first, second one second. We work in close partnership with RVH, and at the beginning of the clinic that we jointly established on the 22nd of December, the great majority of staff who were there at that time were health unit staff, public health nurses, providing the vaccinations. Now that we're changing things, RVH is officially fully taken operation of that site, direction of that site. We are moving our health unit employees out, our nurses out, to be able to vaccinate in these long-term care facilities and retirement homes. And so as they go, RVH staff have been replacing them, but there's also been a very strong response from the community, from many physicians and nurses interested in helping, volunteering, or helping with immunization. And so RVH is keeping a roster of them. So are we as a health unit, and they've been able to bring online some physicians to work in that clinic to replace the staff that we've withdrawn. So that's how things are rolling. If RVH becomes very busy with care, and they do have an outbreak now, I think it would be for them to answer the question, what it would mean for them and the work in the clinic. I know they regard it as a top priority. They share the view that I have, that this is the way that we get out of the pandemic. So they've been superb about dedicating themselves fully to this. But I think you'd have to ask them about how they would manage the burdens that they have. And then you were wondering about, am I worried about people from other hospitals being brought here for care? And what I would say is we're all in this together. And if we find ourselves in a position to be able to help a very hard-hit part of the province, it's a good thing that we do so. I would say it's a very good thing that RVH had the wisdom to establish in the spring and the summer and get going in the late fall. Its pandemic response unit, that field hospital that they put up in their parking lot, it gives them a much more capacity, an extra 70 beds to be able to manage the load of care. So that is a good thing that they were thinking that way, to be prepared for what could very well come and what appears to be happening. In fact, the rise of cases that are happening in the GTA, they're happening here too, but much more in the GTA. And it's good that we're in a position we can help. I think we have to take it as we go. And it may be at some point we need the assistance of somebody else. So it's the nature of this kind of a crisis, an emergency, declared emergency, that we all help each other when we can.
Okay, and my other question relates to Collingwood General and Marine Hospital. As I understand it from talking to them, if you walk into their emergency department, you see their triage nurse sort of soon after walking in, and there's a potential for a COVID-positive patient to be in the waiting room with not COVID patients, and you're not screened before walking in the door. Is this something that's okay? Like, are you aware of this situation?
This is the first I've heard of this. We'd have to look into it ourselves for me to be able to comment. It's certainly appropriate and required for hospitals to screen individuals as they enter the premises to ensure that they do not have symptoms consistent with COVID-19.
If they do find they have those symptoms, can a patient still go into a waiting room, or what's your advice there?
They would need to manage them in a way that doesn't expose other people. So they would need, everybody should be wearing face covering. That's required. Ideally, they would be put in a separate room to be cared for. They should be physically separated from other people at least 2 meters apart. It would certainly be key that they be identified as they come in to be able to allow for all of that.
Thank you.
You're welcome.
Okay, thank you, Erica. Sorry about that. Mark Claremont from Muskoka today. Do you have a question?
Yes, Doctor, regarding the Pfizer vaccine there, so apparently you said earlier on today and on the website, it says something like the neighborhood of 8,000 doses have been administered. Are those all staff, I take it, all LTC staff, retirement staff, are they?
They are staff from hospitals, long-term care facilities, and retirement homes, and also some essential caregivers in the long-term care facilities and retirement homes. There's more of them are hospital employees than employees of the other facilities, but as a proportion of the total healthcare workers that are in these places, it's a fairly even breakdown. A slightly higher percentage of workers in the long-term care facilities are immunized at this point relative to hospital employees.
But was that mostly all the people in hospitals and LTCs that you need to vaccinate?
It's halfway there.
Yeah. Okay. And also, the Pfizer offsite that you're going to be doing by the end of this week, et cetera, et cetera, technically, so the 70 degrees, they have to be kept frozen. What happens? That they're frozen and buried, and then they go to the offsite, and then they're thawed out at the LTCs locally, so to speak?
Yes, in a word. We once you thaw them to fridge temperature, you can keep them for 5 days. If you once you put a needle into the vial, you can use it for 6 hours. So we have a pharmacy team at where we keep the vaccine in Barrie, affiliated with RVH. Prepare vaccine in a cooling device that is then safely, securely placed in the vehicle where we transport it to where it's needed. It's actually seat belted in place to reduce bumping and shock, and then allowed to thaw at the other end, and then the normal saline solution that needs to be placed in the vial is placed in the vial, and then syringe is prepared, and then they go. Once it's been moved and thawed, you can't move it again. You've got to use it all.
Just quickly, the boiled water in Bracebridge, anything new on that?
Maybe you could give me a bit more of a what information are you seeking? Sorry.
Well, I mean, it just obviously it's going on all week there, and apparently they're flushing the pipes and things like that. So
yeah,
you just have to. They said you have to give the all clear
yes,
for them to lift boil water order advisory.
I do. Yes, I issued the boil water advisory order to begin with, to make sure that people were informed that they'd had a water main break, that the water that was coming through wasn't potable, as we say, shouldn't be consumed without boiling, and we would need to wait for the system to be restored and testing to show that it was safe before you could lift that.
Great, thanks very much.
You're welcome.
Thank you, Mark. Is there anyone on the line from CTV?
Sure is. Mike Arsudi's here.
Go ahead,
Hello?
Mike.
Doctor, good afternoon. So here's my question. In the GTA, they're already saying February seems like, at least mid-February seems like a safer return than January 27th. What would you advise here for schools here in Simcoe County and Muskoka?
Well, I think schools is a tough call, right? Because the school environment's an important place for the well-being of children. It's important for their mental health, their physical health, particularly vulnerable children who need a lot of support. And so by having them stay home, they miss out on all of that. And they miss out on education. I know that there's, the remote education, but it wouldn't, I think it would be more challenging to continue full education that way. So it's always a risk-benefit that needs to be done to determine whether you should be continuing this remote education, non-attendance to the school setting approach. I know that there's a lot of concern about the potential for transmission in schools. In fact, the amount of transmission in schools has been very limited compared with the number of cases that arose in the community, children getting it from home or elsewhere instead. And I know also that with a large number of cases, it can be very disruptive to running school if you have many, many cases showing up at school requiring classrooms to be isolated and follow-up testing for entire classes of school. So that makes it a challenge when you have so many cases happening right now. It makes it a challenge for the schools to operate. I think we'd have to wait and see just what the case count is looking like when we get later in the month. I would be advising that they continue to monitor and not make any decisions at this point, apart from the decision, I guess, to be prepared to extend if you have to.
Okay, and then sorry to get you bogged down here in numbers and details and all that, but could you go more in depth on the breakdown? Because the last check that we've had, it hasn't exactly updated the per location for the 68 cases today. I understand New Tech and Bradford had the largest incidence rate. Is that reflected in today's data here? Could you maybe go a little more in depth there on the number of cases per jurisdiction and per township and city?
So I'm not going to walk through all of that in detail. What I'll do is I'll make sure that it's updated on the site for you.
Okay, but Barrie still remains a problem here. Tecumseh, Bradford, and this workplace gatherings in the home, people commingling. That's the main probably source of infection here.
Well, you know, actually, like I said, over 20%, 21% were related to gatherings overall in our area at the Christmas time during the holiday season. So that was a major one during the holiday season. And the data that you see now, the new cases, would be from that time, like 2 weeks in the past or so, a week to 2 weeks in the past. So to me, the major thing at this point is that kind of social gathering that's the driver. Whereas before it was that and a combination of work, very, very limited with regards to school setting outbreaks. We've also got, like, increasingly facility outbreaks that are part of the numbers as well, as I pointed out, all of those congregate setting, long-term care facility outbreaks that have been happening. And then if you otherwise, you wanted to know about the geography, so if you look at our website under geographic area, you can see how it breaks down, at least for the month of January. And the highest incidence rate that we've had overall has been for Barrie, according to that data. This is a little bit behind, I think, compared with the data that I just gave you today, where Bradford and New Tecumseh actually had higher rates than that. Bradford being over 200 cases per 100,000 population per week.
So what is going on here? Because I'm a little slow. So explain to me how this entered into long-term care homes. If they were, we had visitor restrictions, we had so many measures in place to restrict this. Is this the unfortunate situation of gatherings have taken place and commingling with staff, not to throw this on them, or those who work and live in long-term care homes? Because for the majority of these individuals, they ain't going anywhere.
Yeah, well, a good number of them predated the Christmas season, but some of them certainly have followed it or been at that time. We know right back to the first wave that the single most important driver for risk is the incidence in the community. You end up with cases among staff. Maybe they've been part of a gathering that they shouldn't have been, or maybe not. Right? They that gathering drives up the risk for everybody. So it's possible they got it in another community setting. They can be shedding virus and transmitting 2 days before they begin their symptoms, or they may never develop symptoms. And so they can be at work without symptoms and be infectious. Now everybody's wearing personal protective equipment, but if you have a lot of that happening, sooner or later there'll be some kind of a breach in which transmission takes place despite the precautions, despite the equipment. So it's really driven by the numbers in the community, the transmission in the community, setting up a situation so that the risk goes up for staff in these facilities, and then from there to the residents. Or, it's potentially possible as well for their essential caregivers. Same thing, they come into the facility, they're wearing personal protective equipment, but they too could become cases through the transmission happening in the community and then spread it.
So what's happening with Roberta Place? Is RVH going to step in there? What would you advise right now? 40 cases being done.
Well, we're certainly looking at that kind of question very closely. We, sorry, I note some other background. If everybody could check their line muted, that'd be great. So we note we note that it's a very serious situation. We are working closely with the facility. We're looking at options. We certainly have communicated with RVH as well. So we, at this point, don't have, I don't have a specific answer for you to that question.
Thank you.
You're welcome.
Thank you, Mike. Is there anyone else on the line that we may have missed today? Okay. Over here. Oh, okay. Go ahead, please, Dawn. Thank you. I just have a question about the vaccines in long-term care, Dr. Gardner.
Mm-hmm.
We know that the vaccine isn't 100% effective, although it is pretty good. And there are lots of family members out there that are eager to be visiting those people. So once provincial restrictions are lifted, are they still going to have to wait until vaccines are available in the greater community, or will your advice be that there may be greater visitation allowed with precautions?
It's a very good question. I mean, once we've immunized the residents themselves, that goes a tremendous distance to reducing their risk. It's 95% effective. Even in seniors, it's highly effective. Which is a great blessing. We weren't sure if it was going to play out that way, and we were very happy that it has. So that in itself would greatly reduce the risk. It would reduce the risk that much further if everybody's vaccinated. It would tremendously reduce the risk. And I know that going forward in time, as we gain control of this pandemic and immunize ever larger numbers of people in the population and start to see transmission come down, that eventually we'd be looking at lifting all these control measures in place, probably in a gradual way, very cautious way. But I don't have detail. I have not seen, I don't think there is yet any detail on exactly what that looks like, how that will happen, or over what period of time.
Right, thank you.
You're welcome.
Okay, thanks very much, everyone. I'm assuming now that we have taken questions from everybody who's on the line. So we would like to bid you good afternoon, and we will speak with you again next week. Thank you.
Goodbye, everybody.
Thanks so much. Bye.
Project. But if I were to draw your attention when you have time, in the budget binder that we gave you, on page 40, there's a table that forecasts development charge reserves. And it is both art and science to predict when we are going to both spend the money and collect the money. It's difficult to do. But we've made some assumptions in there, and we do talk to both the Salem and the Hewitt's landowner groups to get updated forecasts from them. And then, of course, we try and work with the planning department to look at the built boundary to see what is the revenue that's coming in. We're well short of what we thought. So every year we rebase. So if we assumed that we're going to collect so much development charges in cash, and this time next year we haven't, well, when the capital plan comes forward, we may need to incur more debt to deal with some of the existing projects that we're moving forward with. So there's kind of the conundrum. So in terms of, it's the amount of, I guess, financial risk you're willing to take on. Standard & Poor's has commented that we are at a record high capital expenditures. And they're also watching the capital revenues, so things such as development charges. So if we continue on a path where we are expending the money, but the revenues aren't flowing, then there's a risk. There's a higher risk that the credit rating could get lowered. So I think that was the plan, the capital plan that came forward to you with this project, I believe in the 2027 timeframe, was kind of to balance all our needs and to let some of that earlier work finish that was planned to finish.
Thank you. Thanks, Marilyn.
Thanks, Councillor Thompson. Councillor Kungl.
Thank you, Your Worship. Through you to Ms. Miller. A couple of questions as I'm trying to maybe appreciate what the role of staff may be in this scenario, as well as, you know, is there a criticality that ties to us receiving perhaps developmental charges sooner than later if we can facilitate support to these other landowners coming on board with a temporary solution. And so I think you've answered the majority of my questions to date, but I wanted to acknowledge receiving some information from other landowners around their interest in this. And I wonder if you could clarify for me what the role, if any, city staff have to support that conversation, or does it really sit with the Water Sands group to bring the landowners group together and talk about whether or not this is a potential partnership?
Through you, Mayor Lehman, to Councillor Kungl. City staff are always available to speak with interested landowners. There is a requirement that we work through the landowners group. So there are participating landowners and there are non-participating landowners. And if you're a non-participating landowner, in order for us to formally engage in discussions about your property, there has to be some engagement with the landowners group themselves. So what I would suggest is that there would need to be a convening of the landowners group, and we would ask the landowners group representative to do that, and certainly staff would then work with them to have those conversations, and I'm sure that you know, we would be able to answer any questions and facilitate any further conversations that have not already taken place. But any non-participating landowner needs to join the landowners group in order for us to advance anything formally with their lands.
Thank you. And my next question has more to do with just gaining an appreciation for the infrastructure that's being talked about. So with this temporary sanitation pump and system, although Water Sands, I believe, was referring to 1,516 units, which is their kind of phase one online capacity of interest. Is there a part of the process where that pump-based city, so is there a window of opportunity by which those other landowners would need to come to the table to identify their interest to see if they've actually got an opportunity to tap into the system before it's designed and constructed?
Through you, Mayor Lehman, to Councillor Kungl, yes, there would be a window of time. You know, what exactly that is, ideally before it starts to be constructed. It's always easier to make changes before you start a construction. How much further back than that, even more ideally before the project would be tendered. Do we need to know it today? No. I think we have already anticipated and directed that things be considered to be easily expanded, recognizing that there may be a need for additional capacity. So when it comes to the actual pump station, it's really, you know, oversizing the pump and oversizing the force main. But again, as I've said to many of you, it's not the actual pump station that is the critical piece and that is the critical pinch point. It's the pipes that lead to and from the pump station that is the issue. It's the amount of capacity in the pipes that this sanitary flow needs to be accommodated. So the pump station in layman's terms is not their biggest challenge. It's the pipe capacity. And again, I'll just reiterate, if we're talking about landowners that are not participating landowners at this point in time, that is an even bigger consideration, because right now they're not, having part of those broader conversations. And we always encourage them to become involved in the landowners group.
Okay, thank you, Ms. Miller. That's all my questions.
Thanks, Councillor Kungl. Councillor Riepma.
Thank you, Mr. Mayor. I guess my view of this one is that, we ought to get behind this and get something going in that phase 1 area. And the reason for that is, to me, if the developers are going to build the pump station at no cost to the city, and we're going to, over the next 10 years or so, get 1,500 units built there, each one of them that's going to contribute development charges, the city's better off, and we are in a much better position to pay for the, or get the ultimate design built. So it seems to me that we really should be moving forward with this. I have a bit of struggle with this one. Anytime that I've ever been involved in a landowners group, the battle gets done behind closed doors in the landowners group, and then the landowners group comes to the city and says, we'd like you to do this. And in this case, what we seem to have is, we're not dealing with a landowners group, we're dealing with one corporation. And that worries me a little bit, because we shouldn't be sort of giving preferential treatment to one of the developers. My view is that we've got 2 letters from other owners in that area that kind of dispute or want to be involved in this as well. So I'm not sure why we're dealing with one individual group as opposed to getting the landowners group consensus from them. But it certainly makes sense to me that if we're going to go with 1,500 units and there's a pinch point down the line and we can't have any more than that, or at least at this point we don't think we can have any more than that, then it seems to me that we should find some reasonable way to distribute it among the 3 landowners, since they've all said that they're prepared to pay for it, and it is a throwaway cost. So that would be my main concern, because I think it's certainly in our interest to get this going, but I'm not sure that it's wise for us to give a 10-year exclusive to one owner.